Good afternoon, everyone. My name is Victoria Santos, and I am the co-executive director of Young Women Empowered. Young Women Empowered seeks to amplify young women's leadership and role as courageous change makers. We believe in a world where justice is for all, and we strive to make that a reality. Um, I want to say that when we back it was in the end of February, the beginning of March, when we started hearing about the COVID-19 virus, we were getting ready to host our 10th year anniversary celebration. And we had made all of these preparations and we were getting ready for that. And as we were hearing information coming from the governor's office, we felt like it was the responsible thing to do to cancel our event. So we canceled it on March 3rd. And shortly after that, I went, we said, okay, what does our community need? What's happening? And immediately we started reaching out to the families and the young people and finding out what people knew and what they needed. And knowing that we had to begin to move all of our programmings online and also get resources to the communities and the young people like laptops and care packages, and also finding out the security, whether people felt had food insecurities or whether they needed support with rent, whether people were getting having to go on unemployment, and really beginning to mobilize in that way. So we were preparing all of that when I actually ended up getting sick. And I immediately tried to find a place to get a test, and I couldn't find a test at the time. And so I went into quarantine, and I went home, and I went into basically lockdown. It was pretty horrific experience. And I'm, for 2 months, so this was around March 3rd, so until now, I'm still managing with the symptoms of COVID. And, I feel like the virus has probably moved through my system, but, the ravaging that happens to the body is what I'm dealing with now. And I ended up getting pneumonia. And so my lungs actually, right now, my breathing is a little labored because I've been impacted with the pneumonia. And I thankfully had, doctors that were able to help me work through that. And I can say that I'm actually sitting in a very privileged position because I was able to go into this beautiful home and to nurture myself. And I have friends that were shopping for food and bringing them to me, and medicine, and I was really taken care of. But that is not the case for most people. And I began to realize as I was reading more and more about this virus and this epidemic, that the impact has been tremendous for communities of color, for Black and Indigenous and people of color. And the more I started researching, I realized that that people of color and Black and Indigenous people are, we have been bearing the burden of, marginalization, oppression, lack of health care, lack of nutrition, being exposed to toxic chemicals, all of those things that have really wreaked havoc on the immune system and have created the conditions for this virus to come into our bodies and ravage us. And I didn't realize that it was going to be playing out in my own body, as someone who, grew up in poverty and having very little access early on in my life. And even though now I'm in a place where I do consider myself privileged in the sense that I have a passport, I am an immigrant to this country, I am a citizen now, but I have a passport. There's so many undocumented people in this country that don't have that safety and are not getting support. And so that out of looking at all those issues, I felt like this was the time to have this conversation, because I want people to see and to hear the stories from people that look like us and people who are being impacted. A lot of people are talking about wanting things to go back the way that they used to. And I know that this virus is having an impact on a lot of us, and all of us really, and all of us globally. But we cannot go back to the inequality and injustice that has permeated this country and the world. And so I would love to now introduce you, and then for you to introduce yourself to our public and for us to engage in this wider conversation. Why don't we go ahead and start with Layla Mohamud? Will you introduce yourself, my dear?
Yeah. Hello, everyone. My name is Layla. I'm 19 years old. I'm a second-year student at the University of Washington. I'm majoring in medical anthropology and global health. And so what that means for me is, so I want to go into healthcare policy, and I want to focus specifically on the inequities and injustices that our healthcare system is really built off of. And so in order to do that, I'm studying specifically like the sociocultural aspect of healthcare and how healthcare interacts with Black people specifically, both domestically and internationally. And so how Black people have learned to take care of themselves and take care of one another, both in this country and abroad. Yeah, and so part of the things I do on campus is I've been engaging with like Student Senate since my freshman year, because so a lot of our issues on campus, like UW is really just like a tiny town. It's so big. And I feel like a lot of our issues that we have as a state and like as a county are reflected on a smaller scale on our campus. And so we have a lot of students, specifically students of color, who are uninsured, underinsured, who don't have any access to healthcare outside of like Hall Health and our healthcare facilities on campus. But when students utilize those resources, it's often used against them. And so when you owe money, sometimes they won't let you register for classes, or you'll be held back in other ways. And so they've really de-incentivized healthcare on campus in ways that mostly affect Black and Indigenous populations specifically. So I've been working to try to undo that, but it's really hard to undo things that have been institutionalized, and things that people are actively benefiting off of. They're not so quick to let go of that, but that's really my background.
Thank you so much. Thank you so much. Let's go ahead and go to Elena. Elena?
Hi, my name is Elena. I am a nurse practitioner resident at CMAR. It's a community health clinic in South Park. My background is I've been a nurse before this for 6 years, working at the VA hospital on Beacon Hill. And this is the neighborhood that I'm from. So I've had the great experience of being able to be a healthcare worker in my neighborhood and community. And I've been a mentor with YWE for over 7 years, I think, and volunteered in the capacity as a mentor and also like camp nurse. And what else about my background? So yeah, at CMAR, it's my first year in community health, and it's been a really great experience and really learned a lot in a very real way of how our healthcare system is dealing with this pandemic and the inequalities that are like we are forced to look at with clear eyes that a lot of us who work in healthcare have known, and a lot of us who live in marginalized communities have known exists, and just it's become more apparent. And in our clinic, we typically serve a lot of the Latinx community in this King County area, immigrants and undocumented folks.
Thank you, Elena. And let's go ahead and go with Dr. Ibrahim.
Hi, everyone. First, I want to thank Victoria for sharing such a powerful story. I think that it's really, really important to see every aspect of this illness and how it affects people. So thank you for sharing that personal but deeply, moving story with all of us. I'm Dr. Anisa Ibrahim. I am a pediatrician at Harborview Medical Center, and I am also the medical director of the clinic there. Outside of that, I'm very passionate about community health and really feel that a lot of what systems do in engaging with communities is not optimal, and what we should actually be doing is empowering communities to help address a lot of the we should be partnering with communities in a way that will empower them to help us address a lot of the disparities that exist in the communities. And my reasoning for that is because there's a lot of powerful wisdom in communities, and that wisdom is often taken for granted. Now, there's a lot of medical wisdom that the systems hold, but it's actually the communities that know how to get information to people and know how to deal with their, how to disperse information. That being said, it doesn't excuse the systemic racism and institutional biases that exist within our systems that make us sick in the first place and that make us more vulnerable in the first place. So that's where my passion in community health comes from. I'm the president of the board of directors for the Somali Health Board, which is an ethnic health board model, which I'm so glad is being replicated in many communities here now. And the reasoning for that is it's effective, it works, it's for the community, it's by the community, and it's really holds a lot of the system's feet to the fire in helping serve our community. Over the past COVID hit at an interesting time for me. And it's because I had prepped for COVID right before I went on maternity leave, which was the end of February. My son came a little early. So I had prepped for what I thought was going to be my clinic's response to COVID, and I put in the screening precautions and everything. Then I went on maternity leave, and it has everything has totally changed. And I think that healthcare should not and cannot go back to the way that it was. So I haven't been clinically active. What I have been active though, which made me kind of quote unquote come out of my maternity leave, is the inequities that I see consistently happening in Black and Brown communities in Washington State. When I see the numbers, I felt like I just couldn't sit at home. So I've been joining a lot of sessions while not being a practicing clinician, but really pushing for equity at the state level on conference calls with the state, with people from the state and public health, and getting information out to the communities. And not and equity is not equality, right? It's not just putting out an English flyer and saying we'll get the translations out to you in 2 days. That's 2 days other communities have lost. It's ensuring that there's an equal push on all fronts. And it's also looking at the numbers and believing the story that the numbers share. And I think a lot of the numbers in Washington State recently have shown us that, the Hispanic community is being hit incredibly hard. And that it is what it is. We need to accept it, right? The African-American community is being hit really hard. If you speak a language other than English as your primary language, you are at higher risk. And although the virus has been called the great equalizer, the virus doesn't care who it infects, but it is far from a great equalizer. And the reasoning for that is it doesn't, I think people say that from a perspective of, the virus doesn't care what color you are, which is true, but your risk of being really ill and your risk of dying is higher if you are anything other than Caucasian. And I think we need to have these uncomfortable conversations. And the more uncomfortable people are, the more important that conversation is. So that's kind of what I've been up to while at home with a baby, and just how vulnerable that makes people in general. And our lives have changed, and I think we need to give ourselves grace for that, right? I am at home trying to homeschool 2 kids, and have an infant, and really advocate for community. So I think we just need to be really thankful for everything that we do have, and know that our voices are powerful. We need to keep speaking up.
Mm-hmm. Thank you. Thank you so much. Thank you so much for what you're doing and raising 2 kids at the same time.
My 2 girls, they're great. Now they have a new brother and they're trying to figure it out.
Thank you. And then Rahwa, you have the honor of being last, and there's a particular reason for that, which I hope you share.
Oh my God. I forget, please do add it. So my name is Rahwa Ghebremichael, and there's a lot going on. Currently, what I've been doing is one of the things is being involved in YWE alum. We have an alumni club right now, especially during this time. We meet every Saturday. Right before this, I was actually in a meeting with them over Zoom and just checking in with each other's mental health or whatever, where we're at, how we're feeling, expressing where we're at has been actually very helpful to a lot of women like myself and whoever has been joining us. And that's what I've been doing consistently every Saturday with the young women here in our community. And my background is I'm in the healthcare field. I've been involved I've been a caregiver since, I don't know, it's been a long time, like over since I started college, pretty much. I got my nurse assistant license and I went into the adult family home, and then I went into Swedish hospital, and I've been doing a lot of one-on-one care lately, just going to individuals' home, and that's just till I find my ideal job. My heart is with community health, like Dr. Aisha said, Dr. Ibrahim. Um, I really love community health. That's like I've been doing a lot of research on that and learning more how I could be more involved, because not as my volunteer hours, I do spend a lot of time with my community, whether it's helping them have access to healthcare, telling them where to apply, because we have they have this lack of knowledge. They don't know they have all these resources. Just as a student, we don't know what resources we even have on our campus. Like Layla was saying, like sometimes those resources are very hard to assign just because you have a fee and therefore you can't continue forward with it. So that's what I've been doing, making sure, like especially my community, my East African, are the people I'm involved with highly at this moment. Just making sure that they all have healthcare, especially with this time, is very important, because a lot of them feel like they can't even get tested. And I'm like, no, I got my mom, my dad, and all of them are like, we all could go get tested if we feel systematic, or we've been like my brother works at Swedish hospital, so every time he comes here, surprisingly, we panic, like, oh my gosh, did he give it to my parent? So letting them know, assuring them that like we do have access to these, and like sometimes it just takes one person to let them know they do have access to these. Go ahead, sign up for community health. There's one in Linwood, there's one in Everett. I tell them there's one in East City almost, and you could. So I would like to put that in my profession, find an ideal job that will be able to serve my people, POC, and and I've been helping with translation, like Dr. Ibrahim was saying, how just because English is not their first language, they're automatically stuck behind on the access to the healthcare or how they could protect themselves. Mm-hmm. I've been helping with Fred Hedge volunteer work with translation to Tigrinya, and I'm not 100% great at reading or writing Tigrinya, but I could speak 100%. But so I've been doing it with my community, my neighbors coming together with me and my family, making sure that the online survey, people were surprised I'm doing it without being paid. I'm like, that doesn't matter, because if I don't do it, that means my community are not going to have access to this, because nobody was coming up to do the translation, because it is hard. You have to know English pretty well, and you have to know your language like pretty well to do the online survey for them to put it live. And so I wish they had a professional hire for that. Why do they not have it? That actually took me off a little bit. I'm like, why are they looking for volunteers to do these? Mm-hmm. Why are they prepared? Like everybody should, like, English is automatically out there for everyone to be able to understand, those that do understand it. So, but at the moment, I'm like, I'm not going to go ahead and go back and forth with this, because my people do need to know they have access to see the survey online and in their language. And I spread the word among my community and my church and stuff. But I wish the healthcare system put translation, like, they're very important. They're very, very important. My own father was in surgery, and they used me as his translation, which is very unprofessional. I shouldn't be giving him his medical conditions, like why he's going to be into another surgery because of this and this. So that needs to be more prioritized. Like, how could someone feel comfortable to come forward if you're not meeting them halfway, and you can't have someone step up and ask for help if they know you have no resources for them, So that's what I've been working on lately, just making sure my people do have the access to healthcare in whatever way. I'm not a professional, but I know how I signed up myself. So sharing that knowledge a long way goes like pretty far, when you teach one person, another person teaches another. So yeah, and YV, is that the thing you're saying? Am I okay? YV has been a part of my life since I was in high school, and I started it when, how old was I?
I don't know, maybe like 16 or something.
16, way back in 2010 or so. Yeah, I was a youth, and I became an alum, and then I am on the board right now, which is great, because I'm learning a lot through YV as well, like being the youngest board member. More young ones are planning to join me, so I'm happy about that. And whoa, okay, I'm losing track. I feel
That's okay, Rahwa. What I would add, though, that she's very humble in this, is actually that the reason why Young Women in Power exists is because Rahwa decided that as part of her her project, her school project, she was going to raise money to keep the organization going. Originally, it was just a one-year project, and Rahwa and some of her friends were like, "No, we have to keep this going." And they did a fundraiser and raised $10,000, which became the seed money for the organization. So I just really want to acknowledge that and honor you for that, because that's why I'm sitting here talking with all of you. So thank you, Rahwa. I want to switch to you, Elena, because you were mentioning that you're working at CMAR over in South Park, and that's a predominantly that Latinx community. And when we look at the statistics of who is most impacted in Washington State and in our region in particularly, Latinx is one of the highest. Can you tell us a little bit about what you're seeing and how just bring those statistics to life for us?
So I looked it up this morning on the Washington Department of Health website, because I know those numbers have been slowly being updated.
Yeah.
And I think around like 50% of the racial and ethnic data is still not been like divvied up, right? So there's 50% of the data we don't know. But yes, so this morning when I checked, the Latinx population is about 31% of the COVID positives in the state, where they are about 13, did I say that right? 31% of the COVID positive, but 13% in the state. So like highlighting that disproportionate percentage of Latinx people in our state who are getting COVID. And at CMAR and with my coworkers and with patients talking about why that is, right? So thinking about what in our system is, and the real lives of these people in the Latinx community, why this is happening. So when we talk about healthcare inequity, socioeconomic inequity, we talk a lot about our community, the Latinx community, like the essential workers. So a lot of them have to go to work, don't have access to sick leave, don't have access if they're undocumented to unemployment benefits, and like the federal aid money that's being distributed. So a lot of them don't have the option to not work, and are in a lot of high exposure jobs. So a lot of service worker jobs, working in people's homes, construction, the food industry, and other people of color as well, and like healthcare jobs, like working in people's homes, and also just I think the living situation of a lot of Latinx community, like multi-generational homes, and like what we know about how this virus spreads, like I don't know, like 75% is spreading within the home. And so a lot of culturally, just a lot of people live together as a family, which is a beautiful and resilient thing. And also I think we as an organization and as a healthcare worker that serves this population, like kind of like trusting my intuition how to counsel folks in the Latinx community, like, because that's not what the CDC is putting out, right? They're not like putting out information specifically that could be beneficial to people of color and the real ways that their lives carry out in work and their home situation. We found there wasn't a lot of guidance, right, on like how to counsel folks who live in homes, maybe with people that aren't part of their family, right? So like so those sorts of things that, I don't know, at work we kind of call it the Wild West, and also like trusting our intuition as people who are a part of these communities and serving communities of color, like coming up, like, I don't know how to say it, because the institutions aren't giving us the information we need, I think sometimes to, you know what I mean? I don't know where I'm going with this, but like trusting, like, okay, I know my community, I'm talking with my community, like how can I respond to the COVID pandemic and meet the needs of my community, the stories that aren't being told, I think, in the mainstream. I don't know if I answered your question.
No, absolutely, absolutely. Does anyone else want to jump in on some of those statistics, either for Latinx or other communities that you're seeing? Yes, Dr. Ibrahim.
Yeah, so when I look at the numbers, especially as we reviewed them with the systems folks, it is true. I think an even bigger thing, other than just, you know, which community you're from, is limited English proficiency people who speak a language other than English. They're in isolation where they cannot advocate for themselves once they make it to the hospital. They're not getting good enough information pushed into the communities, which makes them more likely to show up sicker than other people. And then because they're being admitted sicker, there's no one to advocate for them to, you know, aggressively get them the best health care if they are not an English speaker. And, you know, it's difficult enough to get PPE or personal protective equipment for nurses. So certainly, you know, it's much harder to always have an interpreter for that person who does not speak English as a first language or prefers not to communicate in English medically, regardless of whether they speak English or not. If they don't speak it well enough to get medical care, then, you know, that's the right that they have. And it's become more difficult. So essentially, I think what we're seeing the fault lines of systemic racism play out right now. And that, you know, it is what it is. And I think that when we look at those numbers, are telling a story, and it's really, really important to get those numbers out. So I really encourage everyone pushing whatever system they interact with to get those numbers out. Because before a few weeks ago, we didn't have limited English proficiency data, right? Even then we have 50% reporting. So we are definitely seeing that. And I think a lot of the recommendations that the CDC or, you know, many other people are giving are rooted in privilege, right? Isolating yourself, that's rooted in privilege. That assumes that you have a room to isolate yourself in, right? It assumes that you don't live in a multi-generational household. It assumes that you have the privilege of not being able to work and have a network that can actually get things for you. So it assumes a lot of things, and even those recommendations have to be then looked at and say, like, where are the privileges in this, right? If you live with your grandma, you don't have an option of not sharing space with your grandma, right? So what can we do to mitigate things despite, what can we do to mitigate recommendations that are rooted in privilege, so that the families who are multi-generational households, which is beautiful, right? That's how many people grew up, and we don't want to let go of any of those things. But, you know, how can we keep everyone safe, even if you do live in a multi-generational household? If you don't have a room to isolate in, how can we still keep our community safe? And that's the information that really needs to get out to the communities.
Mm-hmm. Well, yes, later on in the conversation, I would love for us to speak a little bit more about, you know, some of that and troubleshoot for the community. Layla, do you want to just tell us what's happening in your side of the world? What are you seeing from the youth perspective and in the university and such? How are your colleagues managing?
It's been really interesting to see, for sure. So at the university, I've been noticing like a couple different things. One thing is immediately, so like once school moved online, so we moved online at the very end of winter quarter. So our last 2 weeks of winter quarter, and then up until now, we're at like week 8 of spring quarter, have all been online. And so a lot of students who rely on like on-campus jobs, like who work for like housing and food services, who might work at like different buildings, have unfortunately like lost their jobs. So on that end, there's been a huge loss of income, as we've seen like across the board, but specifically for students. But there hasn't been like the balancing of like tuition and things. Like, so students who like pay tuition have still like had to pay the full tuition for like winter and spring quarter. One thing I have noticed is, so there are certain students in certain jobs that have been moved online. One of those jobs, like some of those jobs being like students who work within like ASU dubs, so like the associated students like within the student body. So not like student senators necessarily, but the board of directors, things like that. Those students are still getting paid. They're still, so they're obviously everyone's lives have changed, but that source of income has not gone away, which is amazing for them. But when you look at which students get to be in those positions, you start to notice some patterns. So you really can see who
What
is
are
getting
the patterns you're seeing?
The patterns I'm seeing is that like this, a lot of the students who do have the privilege to keep their jobs and to work remotely and to work online are the students who maybe are not so reliant on who are maybe not so, who are not, I guess, so as financially insecure, or and so that racially translates to students, white students. It's very white. And when you look at things specifically, like within student government, like just like the things that students are focusing on, and like the way, so our Senate meetings were Tuesday evenings, and they've moved online. And one thing that I've noticed is that there was no grace being given to anyone really. And that was something that frustrated me a lot personally, because it's like, once everything happened and we moved online, I really had to start focusing on my own family and figuring out how I'm going to take care of my family and how we're going to stay safe. My focus honestly shifted away from school. It shifted away from student government. It shifted away from all the extracurriculars and the things that I love to do. But not everyone's focus has. And so one thing I saw was just like constant emails of like, hey, we missed you at this meeting, or hey, this, and this. And while those things are still important, it is important to keep your routine for your mental health and like for your own sake. The lack of acknowledgement of the toll that this has taken on students of color, on students who live in multi-generational households, on students who really are the translators for their families, was incredibly frustrating for me. And so for me, I have a work study job. And so I'm very lucky that my position, like work study, is continuing to pay me, even though I'm not physically at my job. So financially, it has helped in that way. Financially, it also was able to give a refund to students, because a lot of the students who are on financial aid don't qualify for the stimulus check. And so that money has been given back to many students who really do need it the most, which I think was a move that surprised me, but that I did appreciate. UW has not been known to care about the students that are most vulnerable. And another thing that I've noticed that it has been like personally incredibly scary for me is just on my own like familial level, is figuring out how I'm gonna, like I said, like play the role that I need to play for my family, specifically for my grandmother, but also keeping a safe distance and like keeping people safe. And so something that I've personally been struggling with, and like I know a lot of other students have been struggling with, is trying to get across just how serious this is. And so I've noticed a lot of like older people who English is not their first language, English is not something that they learned until a lot later on in their life, have been taking the pandemic a lot less seriously. And that's not because they don't care, it's because no one's cared to translate just how serious it is to them. And so it's been incredibly difficult for me because like my Somali is not great. I speak with a very heavy American accent. And so to try to like get across to my grandparents and to get across to their community, like you cannot be seeing each other right now. You cannot be visiting your friends' houses. You cannot be going out. You cannot be going to these places for your own sake. Because again, a lot of older generations, for my own community specifically, a lot of older Somali people are immunocompromised, have pre-existing health conditions, have like everything set up against them to be the most vulnerable for this pandemic. And so I felt, and I know a lot of other people like me have felt very powerless in this time. I felt like I've kind of had to sit back and watch things fall apart in front of me and watch like people I care about be like endangered in a way that like I can't stop. So it's been, yeah, I'm so sorry. I've like gone in 10 different directions.
Oh no, you're right where we need to be, and we're right with you. Thank you so much for sharing so deeply.
Yeah,
it's heartbreaking.
Yeah.
Thank you. Do you feel complete, or was there anything else that you wanted to say?
I'm sure it'll come. I've lost my train of thought.
All right.
Yeah.
All right. Now, Rahwa, I want to switch over to you because for a long time, I mean, ever since I known you, you always had this spirit of service. And I remember even like when there was like a snowstorm and there were, people were in all these cold spells that we were having in Seattle, and you were sending out emails and texts asking people to donate coats and gloves and socks and warm things so you can take it to like homeless shelters, and also here you recruited young people to go and help to feed the homeless. And so I always seen you as that person that just has this this desire to serve and this big heart. And so I'm wondering, you know, with that, like how is it impacting you, one, in just in terms of what you're seeing, and also how are the people around you, like how is it impacting them, and anything else you'd like to share around that?
Oh man, I personally have not been feeling safe enough to go join and feed in the homeless. I do really want to, but I don't have the proper equipment to, because I cannot come back home to my parents and my infant nieces and nephew.
Mm-hmm.
Um, that's something that's always been in my mind, like what is happening to them, who's helping them. But I have noticed when I drive to Seattle, I don't see them out as often. So it made me curious, like what happened to them? Where did they go? You know, like I hope somebody's like taking them into shelter, a safe space. It's a big hope to ask. But I've been just, this thing has impacted me personally in my work life, searching job, just because everything is on lockdown. And right when I was in transition of like doing different kind of interviews for different fields, this whole lockdown happened, so I wasn't able to continue with my interview process. But today I got a call right before this meeting about saying I'll have an interview on Monday.
Ooh.
Yeah, that's great news. Exactly, I needed it, whether I get the job or not. But just to have the interview is, I feel privileged. I feel like blessed to do that. How this has impacted me, like Layla was saying, like my parent took a while to take this thing serious, to stay home, to not have guests over, don't want to talk to your neighbor. It's part of our culture to greet and hug and kiss our neighbor, so that's been a bit hard to transition to, because one, I speak English, I hear English, I read English 100%, right? I see the news daily thing why we should not, like why we should follow these guidelines. But them, what are they hearing beside my voice, So that's been hard with my family. Just, I mean, even my young siblings have been having a hard time following that. So I could only imagine to those that do not understand what's happening. It's just like a kid, you cannot tell them don't touch something unless you explain it to them why. I'm not a professional translator in medical terminology, to let them know why it's so important beside my personal opinion and my translation to them, so that's been a bit difficult, trying to get my community to stay home, not just in my family, but also like whether it's church or whether it's gathering. Like our country Independence Day is coming up next weekend, so I don't know if these people are going to stay put, like it's going to be hard because they do want to celebrate. It's a prideful day. May 24th, 1991 is when Eritrea got the independence. So of course everybody was gonna want to come gather, but I hope if they do come gather, do like 6 feet distance. But just them not hearing it constantly in different languages, has always been provided only in English. So I cannot blame them for not following all these guidelines, because they don't have full knowledge on it. The lack of knowledge, lack of education and resources too, like I said previously, why is it not a priority to have this translation? Because when they were asking people to translate for, whether Fred Hutch, I think that I was helping with, they weren't just asking for Tigrinya. There was like at least 12 other languages. So I'm like, what languages were you guys even prepared for? That's the question that came up to me. Like nothing, exactly. I'm like, did you guys even have, besides Spanish, English, and maybe Arabic, like the main languages? But did you have anything else? Because they needed Vietnamese, they needed like some Cantonese, a whole bunch of different languages. So it made me think, like, dude, like you're in the healthcare, you should have all these languages ready, lined up. This is not something new. We've been warned, the minute we heard China's been impacted, we should have been prepared, And I don't blame the healthcare staffs. I blame the people that could have taken charge, raised funds, give funds, because Elena, the nurse, Aisha, the doctor, she can't just provide those herself. The administrative needs to take bigger action, bigger steps to better provide for people of color, and that's my family too. So I don't know. It's
overwhelming.
Yeah. And you can't blame them, for not understanding that. Like, what can they do? They just think it's like, oh, don't be scared, it's gonna be fine. But people that have been hearing this news over and over again on the TV with a lot of information, with a lot of YouTube resources, are still having a hard time believing it. So imagine those that don't even have all these resources. How are they going to believe that they're in danger, So yeah, that's my thoughts on that. But
thank you, Rahwa. Well, when the final point that you, there are a lot of conspiracy theories out there, right? And then, so a lot of misinformation that are actually putting all of us in danger. But Dr. Ibrahim, can you, share a little bit more about some of the statistics that you were mentioning earlier? And because, being a doctor, and especially a pediatric doctor that starts very early on working with young people and with families, actually, right? And they're growing a child in the womb and then birthing them and then raising them, we've been hearing a lot about the childhood adversity index, right? And how a lot of the compounding exposures to trauma and all the different things have weathers our body. There's a lot of this term of weathering. Are you with us? Okay, yeah. The weatherings of the body has had a lot of impact. And so can you just tell us a little bit more from your perspective? Oh, we can't hear you. You're muted.
All right. Okay. All right. So the statistics, like Elena was saying, we don't have all of the information that we need. We have a few different healthcare systems, and the reporting is different. So, I think but what I can say with the numbers, and like Elena said, only about 50% of it is reported right now, based on the population, like the percentage of the population, Black individuals who are, African diaspora, African American, anyone who checks Black or African American on the demographics, and people of Hispanic background are disproportionately affected, meaning that if you compare the percent of the population to the percent that's impacted by COVID, it's disproportionate. More people are being impacted. And what I'm also seeing just anecdotally, meaning, I don't have all of the specific data for it, is that those who are presenting to care and those who are getting tested are the ones who are having more severe symptoms, or they're the ones who have family members that have more severe symptoms. So unfortunately, it means that the proportion who are being tested and testing positive are unfortunately ending up in the hospital and and are also dying from it, essentially. So, those numbers, I think, we will continue to see, and hopefully we'll get a better picture of what that means. I think extrapolating that data to specific communities is very hard because, what I'm very, very interested in is that language data, right? Language is very, very important, but language data is self-reported, and language data, there are people who may or may not feel comfortable, right, specifically reporting a language. And it also misses people who are comfortable speaking a specific language, but are from a different community. Like when I ask for data in the Somali community, right? Because our community was not getting a lot of information, and through the health board and many other avenues, we started having weekly Zoom meetings, community conversations with COVID. We started partnering people to get vans out into the community to actually test. But when you make that pitch, you want to have data behind you, but it's very, very difficult because of the numbers, there's no way to tell how many people are Somali, right? Because they can only see, which ones have marked that they need a Somali interpreter. That doesn't take into account people who have a good grasp of the English language but cannot communicate effectively when you're talking about medical terminology, when a person's in the ICU. That doesn't take into account people like me who are of a Somali background but speak English just fine. So it's really difficult to get data like that. And again, it's self-reported, so you can, there's only a certain amount. The other thing is we really have to understand the privilege in reporting data. People are scared to report data, right? And that's important because it has been weaponized against communities for a long time, and that's, it is what it is. So it is a system that is working the way it was built to work, meaning that when you report the data, you're afraid to, so then you don't report, and then we don't have the numbers to address the inequities in healthcare. So I think it's a system that completely, there's no fixing it. It just needs to be dismantled and started, built up from the beginning, because unfortunately it's working the way that it was built, and that's against people of color, and that's how many things have kind of kind of worked. And I think many times during the things, what we do is we kind of, fix the leaks, right? We bandage all the leaks. And right now I think is a good place to just like tear down the structure and, restart to build and really get to the heart of why many of these things are continuing to happen. I think, the other thing that is leading to a lot of unease is we're continuing to learn about COVID-19, right? And there's a lot of information. There's a coronavirus, which is the mother group essentially that COVID-19 comes from. Coronavirus is, there's many of them, right? There's a lot of them. So there's many people who are saying, oh, there's nothing to worry about. There's been coronavirus, in the community before. That's not what we're talking about. We're not talking about just coronavirus family. We're talking about specifically COVID-19, which we have seen can lead to, we've seen that it's highly infectious, and we've seen that it can lead to healthy people being in ICUs and dying. That's not what the typical coronavirus that other people are saying, oh, there's no big deal. That's not what we're talking about here. And in the beginning, it was that, like kids were not affected, right? And I knew from the beginning, right? Many people were just like, oh, this is not a problem for kids. And there's no way that adults were infected and kids were not infected, right? Kids are human beings. So what that meant to me was we're either going to see what's going to happen in the future, or kids are the vectors, right? Like their body deals just fine with the illness, but that doesn't mean that they're not passing it to their grandmother and their mother or their older sister, right? So it's a blessing that kids were not ending up in the hospital and they're not as sick as other adults, but they're exposed to it and they can get it. And even if they're asymptomatic, they can pass it to other people. The other thing is that, now we're starting to learn that there might be a very, very rare, but extremely severe inflammatory response that happens to kids once they get coronavirus. And it might not be the typical cough and fevers. It could be significantly worse. So we're starting to learn slowly about it. So it's really, really a time to be very, very careful with everyone in the household, including kids. And then the other thing that I've thought a lot about, especially having my own daughters at home and having, my infant son, is the mental health impacts of all of this. Kids have just, had their entire life disturbed, right? They went from going to school 1 week to being on lockdown, to not being going outside, to not having a lot of adults talk to them, but sensing that there is something wrong, and knowing that there's always, they overhear everything. They're incredibly smart. They hear whatever you're watching on the news, and they start to internalize some of that anxiety that adults have. So it's really, really important to talk to the kids, all of our kids, about what's going on, what we're feeling, because whether you say it or not, they feel what you feel. And we don't want them to, especially my kids, I talk to them because I don't want them to equate, I want them to have a good age appropriate sense of what is happening, right? A few weeks ago, I asked my daughter, I said, what do you think about when you hear coronavirus? And she said, death, right? That was the only thing. So it made her terrified to even hear the word, because, I would say, oh, I'm talking to so-and-so. Do they have coronavirus? Right. And that is essentially what, the only information that she's getting. So it's important to have good mental health check-ins. It's important to know that they are resilient, but stress changes your body at a cellular level, right? And that cellular change can get, we feel it for generations, many generations to come. So it's really, really important to try to mitigate whatever we can in our children, because they're feeling it, they're hearing it. And that may mean many different things. That might mean having a conversation with them. That might mean not stressing when we can't log on to Zoom for their class. They're doing distance learning and trying to learn new things through a computer, which has so many inequities that we can do another Zoom session on trying to do social distance learning through a computer for children, which I think is the worst thing we've ever done. I'm so appreciative of the teachers. I absolutely love the teachers. I cannot wait for the kids to safely go back to school, but it means that the kids who have laptops and have privileged parents who can read and write get taught, and the other ones, despite how hard the teachers are working, don't. And that was, anyway, so other times it might mean just having a little bit of grace with them and saying, yes, you can run outside before doing your homework. It's fine. It's fine. And, their worlds have been turned upside down, and they're going to feel this. They're going to feel this for a long time.
Thank you for sharing all that. Elena, I want to bring you back into this because at one point, we're talking a lot about racism, and we're talking about the way that it's impacting us. And very early on, when we started hearing about the virus and it being linked to Wuhan, there was a lot of anti-Asian sentiments that were beginning to get stirred, including from top officials. And so how has that impacted you at all, or anyone in the community that you're part of? And if you'd like to share.
Yeah. So I am half Filipino and half European descent, and I present very white. So I personally haven't had that experience, but definitely I was having conversations early on in March with some other fellow Asian community members and healthcare workers, and talking about the mask specifically. I guess where I'm going with this is talking about just like the wisdom of the Asian community of like wearing masks wearing masks just in general to like protect people, and the sense of like community of like, oh, when I'm sick, like I wear a mask and it keeps everyone else safe, right? And her and I were talking about the CDC announcement very early on, advising the public not to wear masks. I understand part of that. Can you hear me okay?
Yeah.
I understand part of that was reserving masks for healthcare workers. But her and I were talking about, she's like, can we do a gut check on each other? Like, why are they advising people to not wear masks when everyone in China and in Asia and the PI is wearing masks, just because it's such a basic public health thing you can do to protect other people? And just talk about the stigma of like Asian folks wearing masks, right? Like a lot of them were getting discrimination and racist stuff yelled at them during coronavirus, like still, but early on. That has happened in Seattle, no matter how liberal we think we are. And talking about like the stigma with that basic safety wisdom, right? And like, it took 2 months for the universal masking to be recommended by the CDC. And just like reflecting on 2 months ago with this community member, we were both like, yeah, it makes sense. Like, this is a wisdom we know. This is how we know to keep each other safe. Like, it just makes sense to wear masks. And just, I guess what I'm trying to highlight is like the knowledge and wisdom in communities of color of like how to keep each other safe. And yeah, just the delay sometimes in that wisdom being acknowledged and adopted, and kind of the frustration around that. And I've kind of felt that very early on, just about like a lot of the things we can learn from Asia, where they have been hit first by the virus, and like really seeing our systems and leadership that I've worked with kind of like having this delayed reaction, like not really looking at like the places of wisdom that have gone through this and being like, okay, what can we learn from what they're doing well in Asia right now? We don't need to reinvent the wheel. Yeah, and I guess what I'm trying to comment is like our communities have wisdom, and it's important, and that's part of like why I don't want to go back to the same healthcare system, because that wisdom is severely underplayed and not valued, and I think can really benefit all of us, like all our communities. And I think one thing I did want to add, when I was listening to Rahwa kind of talking about like looking at our healthcare systems and seeing it respond in early March, I just wanted to share about like, so I was interacting with, my institution. I was volunteering at the coronavirus call center with public health. And I remember very early on volunteering at the coronavirus call center, and they were getting me ready to like be one of the phone callers to like accept people's phone calls. And they were like, oh, we're getting a lot of phone calls about like, why are the community health centers not testing people? Their primary care fighters aren't testing people as often. We don't really understand why. And I was like, whoa, hold on. Like, I can tell you why. Like, your system isn't communicating with our system. Community health centers are like severely like under-resourced, right? And like all these resources we need to be able to test our community, like we don't have. And it was like, I had this very like real feeling of like, oh shoot, like we're it. Like, I don't know if you all have had this feeling too, but like, I'm it, we're it, nobody's coming to like save our communities, right? Like it's us and our positions. whether it's like as the family member or as the healthcare worker or the person in public health like Layla, right? Like we, yeah, like no one else is coming, right? Like these institutions aren't coming to save our communities. Like it's us that's gonna save our communities. And I was just really, really feeling that in March, in a both grief way, because like I was like checking my naivety of like the CDC and like public health. Like they also don't know what our communities need. Like we know what our communities need, and just seeing about like moving forward, it's just like so apparent to me, like how important it is for us to be where we in the rooms the rooms we need to be in, you know, and in healthcare leadership, in the CEO boards, you know, in the conversation with our elders, like it's us. So
Thank you. Thank you. And Elena, I so appreciate you bringing us back to like, yes, it's not only, you know, our communities are resilient. We have historical knowledge. You know, most of our communities have gone through war, famine, all kinds of destruction, you know, and we have knowledge. We have deep knowledge that is ingrained in our genetic makeup. You know, and so one of for me, it's been really an honor actually to be living in Washington State and living particularly in Seattle and the Puget Sound region, and seeing the way that our communities have been mobilizing to support each other, and you know, working out of El Centro de la Raza and seeing how immediately they mobilized to, you know, provide support to the Latinx community, and then seeing people like some of my friends working with the undocumented people and getting them food and mobilizing, you know, rapid response funding and getting people resources immediately. So it's been a really a wonderful thing to witness. But now I think we need to focus on the long term. Like it feels like as we move through this virus, right, that at first it's like immediate response, like shock and awe kind of thing, like shock. And then now we're kind of been with this for a while, and things are settling. And even while some people are like opening up spaces right now, there still is a big risk. And some people are saying that we're going to be with this virus through the summer and beyond, right? So we have to look at some of the repercussions like that are going to come through that, with that, like the mental health issues, the people with their homes and perhaps losing their homes, if they have a home, you know. So let's turn our attention to focus on that, and let's go ahead and open it up now and let some of these other voices, because we actually have about 50 plus people watching on YouTube, and they have some questions for us. So the first one I want to ask comes from Hale, who is a YWE member, and they ask a question: how can we better cultivate healthy emotional environment for children? How can we yes, I see you, doctor.
I think that it is really all about doing a check-in, an age-appropriate check-in with children. One of the biggest misnomers is that, you know, we can create this kind of like naive cloud around kids, that if we don't talk about it, then it doesn't affect them. And we are really bad at hiding our internal emotions. Our kids feel it, our kids see it. So I think honesty is always the best policy, and talking to them, and always checking in emotionally. And I think using words other than "how are you doing?" because I think we're all cultivated to answer that question with "fine," like, "oh, I'm doing well." And I remember the last time I was just looking at, you know, people checking in with me over the past few months, and they're saying, "oh, how are you doing?" And I'm like, "oh, I'm doing well." And I'm like, that's a complete lie. Like, you know, things have been insane. Like, I'm not. Some days it's kind of insane how I'm doing, and my emotions are up and down, and I'm worried about different people. I'm worried about family members. I'm worried about community members. But we're cultured to kind of say, "how are you doing?" The answer to that is "fine." So I think changing the way that we ask our kids questions is very important. And something that I actually got from watching my kids' teachers interact with them is they say, tell me about a high and a low today. So that's a shout out to my two kids, social distancing learning teachers, where they specifically ask the kids, give me a high and a low for today. And that's brilliant because it makes them think about what made them feel good today. And then it gives them a low. And sometimes the lows are silly things, like my mom wouldn't let me have ice cream for breakfast, which I'm like, that's cute, you know? But then sometimes the lows are very important things, like I really miss my grandma today, or, you know, my aunt is sick and I'm worried about her, or, you know, I just want to be able to go to the playground. And it helps us kind of address the anxieties or the, you know, those low feelings that our kids are having. And then if they see you in a mood, kind of knowing when, especially culturally, it might be a little bit harder when they see you do things, knowing how to react to them, right? And you know, the other day, my daughter said, why are you mad? And culturally, you know, when you say that in Somali, it sounds awful, right? And I remember my daughter said that to me. And I was like, what did you just say to me? Then I had to check myself. I'm like, what in me, in my response, made my daughter think she was like, I was mad at her, right? Like, what was it? Because I was frustrated. And I had to actually step back as a parent and check myself and get rid of these roles that we have as like a parent and authority and a child and discipline, and really think that, you know, I'm sorry, like whatever, I was irritated. Certainly it was not at her, you know, and I don't know what it was that day. I can't remember back, but I remember I had to stop and check myself and say, let's talk about this a little bit. Like, this is, I'm sorry, like whatever that was, I'm not mad at you. And then I needed to explain why I wasn't mad at her or what was going on for me, because she sensed that I was mad. But many times I think we lose those opportunities with our kids because, you know, they'll say something, and I think the dual language thing is also hard, right? Because something that sounds so benign in English, when you say it in Somali, it's like, what just happened here? Or something that sounds benign in Somali sounds different in English. But just really checking in with the kids and saying, like, this is what's going on for me, because we don't hide things well as adults. We think we're great at hiding things, but kids, even if you have a smile on your face, they sense something is wrong. They sense worry, they sense that, and it makes them anxious if we're not talking about these things. So talking about them is really important. And then doing that actual check where we truly do ask them to share that information with us, not just a, hey, how are you doing, but kind of what's going on for you today? Like what made you feel good? What made you feel bad? And what are things that you are thinking about currently? I also think just like doing things like art is really important, like, you know, is fun, because I think it gets kid, or whatever the kid likes to do, because it gets them to express certain things that they have not been able to, and then just having a lot of grace with them. I think we are trying to recreate structure in a place in a pandemic, which shouldn't even be. Never have we ever had to deal with this before, and now, you know, we are saying you have to log on for class, you have to do your homework, you have to deal with everything else that's going on in your life, and being stringent on that, I think, will cause long-term harm. And really having the days when it's just like, well, today's a rough day, it's not going to be the end of the world if we don't get everything done, and taking that time to actually learn about different things is actually more important. And having that grace with them, I think, is really, really important and goes a long way, because our kids are resilient, but man, we at least have the words and the ability to talk about certain things, and they are growing in a time where everything has been turned upside down, and they still wake up every day with a smile and really, you know, like really show us the positive in the world. So I hope that gave you guys a few different tips and things that I've been trying.
Thank you so much. There was another question that came up, and I want to contextualize it and say that you know, when we came up with the idea for the panel, it was really reaching into our community and people who have been close, like yourself, you know, to speak and to tell your story, because we really believe that we need to have these stories being told by those who are most impacted and are closer to it. Having said that, there isn't a Native American representative, and there's also a lot of other communities that are not represented in this panel. And my hope and desire is that other communities and other groups continue to create these kinds of forums, and that our voices and the voice of Black, Indigenous, and people of color get amplified, and that our stories get heard, because as you just from this small sample, we can see that our stories are very different, and that we're being impacted different than what the dominant culture is showing. So I want to say that, and then also just knowing that yeah, Black and like the Indigenous communities are in dire strait right now. I mean, when I'm listening to the news and I'm hearing about what's going on in the Navajo reservation, you know, that they cannot even establish a checkpoint to have people just stop, to have them ask them questions as to about where they've been, to have them tested, and then before allowing them to come into the community, knowing that they don't have the healthcare facilities to take care of a lot of people if they were to get sick. And then for that to be like an unreasonable, crazy thing, it just is mind blowing for me. So I just wanted to honor that and just say that that our thoughts are with them and my thoughts are with them. And I also, the same thing is happening in Pine Ridge. I was recently in a dialogue with some people from the Pine Ridge Reservation, and they got into lockdown, and they're going deep into their traditions in terms of doing lots of sweat lodges and really taking care of the community. But they live in multi-family houses too, and there is that concern that if someone came from the outside, that it would not just be 1 or 2 people infected, it could be 20 people at once, and their concern. So wanting to say that. Let's keep going. We're talking a little bit now about, actually, before we go to that question, I want to ask you, from your traditional perspective, how do you deal with grief? How does your community, how does your family, how do you deal with grief?
I would like to share how my
Thank you,
community
Rahwa.
shares grief. Yeah.
Yeah.
So it's a big deal when you lose a loved one, like the whole community is involved. So right now, this time, it's actually very scary to lose a loved one because you can't properly bury them, you can't do the whole prayers, and there's a lot of tradition and religiously thing that we have to do, and the community is meant to be. That's like the most important time, the community to gather more than celebration. Like in my community, at least, it's more important to us to attend someone's funeral than someone's wedding. So not being able to attend, and it's been scaring the hell out of my mom. She's like, oh my gosh, God forbid, and we don't have to face this, you know? Is not being able to go visit, even when someone is in the last stage of their life, has been pretty hard to witness. Like, I haven't seen anybody, but my parent have witnessed someone in the hospital, but I can't even go visit them. They can't even go say the last goodbye. The way we do our tradition is we gather as a community. We do it either at the church or the community center, and everybody gathers there for a week to let the family grieve. And you're there at the community providing food for the whole week for the guests and whoever is coming. And pretty much people come for the day for 2 hours, visit throughout the day, and come the next day. And funeral is huge. It's like public. It's not private. Where in American culture, funerals are very private, invitations only. Where in our culture, the whole community is invited, whether you're on speaking term or not, whether you're not even at peace with each other. When it's grieving, you're all together again. So this would be absolutely like very difficult for my community to face right now if we were to deal with. I haven't known anyone that we have to deal with grief now through this COVID thing, but it's a very big community gathering. I don't know how they would deal with it. I don't know how they would act. It's actually scary to see, to even imagine what would happen if we lose a loved one or someone in my community, because I don't think they would. I don't know. I'm not even going to speak there, but it's a community gathering. I don't know how it would end up happening.
Thank you, Rahwa. Yeah.
I'll say that we deal with it in the same way in the Somali community. We deal with grief through community, through gathering, through having a janaza prayer for them, and gathering at the house of the loved ones and showing community support, and visiting the sick is also something that's incredibly important to the community. Our Prophet Mohamud, he encouraged it. Visiting the sick is a good deed, and not being able to share in any of those things is really, really difficult. And we've had 3 Somali deaths due to COVID in the community, and not being able to gather has been an incredible stress in the community.
Mm-hmm. Thank you. Anybody else? We're good. Okay. So for the time that we have now, and let's just focus on, because it's already 2:11. I mean, we could just keep talking here, and there's a lot of really good questions coming in, but let's focus our attention about knowing the systemic inequalities that exist around healthcare. How can we, what needs to change so that we don't go back to those systems, and what can we envision for a new system that works?
Oh my God, so much.
Please speak, because this video will be available and we will forward it.
Yes. I think so much needs to change. I think that every single policy and practice that comes that is implemented needs to have an equity lens. Like we need to actually have equity and equity committees that actually focus on change. We don't need to have committees that just want to be there without actually focusing on change. I think many times I will call out many institutions for having equity and diversity committees, and as soon as some radical change is suggested, it's kind of like, well, we didn't really want to hear that. We just wanted to hear that we were doing an okay job. And that's not going to work. So I think every single policy, procedure, or practice that comes up needs to definitely have an equity lens. Like which of these things is rooted in privilege? Which of these recommendations needs to actually be checked for? Is it possible to implement? Who are the communities that we are not going to be able to get to? Why are we having communities do translations on their own when we should be doing them and we have the money to? And I think because it puts communities into places where we were feeling the same way that you were, Rahwa, when it was at the health board. We can either translate this for free and get it out to our community, or we could, not have our community get that information, and essentially we're doing the system's work for them. So there needs to be more partnership with that. I think the systems really need to depend on community organizations and community essentially leaders and elders to help them get information into the community, right? The community, like many of our communities, whether it be Black or Indigenous, we trust people from our community to get that information to us. And we will put more value in, having a partnership rather than being told what to do from a top-down perspective, because many times when that happens, it doesn't work because we don't know how to effectively get information into a community and have that community take that seriously. And then I think many times the health systems think we know how things work in the community, and then we come with a top-down approach, and it really needs to be from a bottom-up approach. It needs to be going into the community, seeing what they need, and then helping address that, rather than saying we think this is going to work and then having it fail and then say, gosh, I wonder what we did wrong. Well, we did a top-down approach. That's what we did wrong. So the top-down approach really needs to stop. And with that equity lens, I also think there needs to be a lot of kind of pushing the barrier and seeing which of these practices have always been rooted in racism. And that's a really, really hard thing to call out, because I think what's happening right now in this pandemic is we're seeing the fault lines of racism and discrimination in the United States. And it needs to really look at, it's not individuals that we're calling out, it's the system that we're calling out. So don't get uncomfortable because we say this system is not working well. We're not saying that you created that system. This system has been there, but you're helping.
And if you get uncomfortable, investigate why, right?
If you're getting uncomfortable, that says something. So many people are going to be uncomfortable, and that's fine because people are dying. Like it's okay for you to be uncomfortable, and you need to, that's rooted in something. So I think those are the really, really important things. And I have, I've been humbled many times in my medical career and saying, like, I'm from the Somali community, and I think this will work. And having a Somali grandma say, no, this is what's going to work, right? Because she knows, and she knows how to get information out there. And I have seen WhatsApp groups be more powerful than any social media campaign a 20-year-old can come up with, right? And those are the people we need to be talking to. And those are the people who have community knowledge and not medical knowledge, and don't have a medical degree, but can get that work done in the community. We really need to put a lot of emphasis and a lot of power in that historical knowledge that people carry. And another little, this is just like my personal thing. I think that I have really come to not like the term vulnerable communities. One, I think it serves a purpose, right? You need to pay attention to communities that are vulnerable, but that's not an inherent quality of that community. It's a system that considers them vulnerable because we've made them vulnerable due to the systemic issues. But those communities are some of the most historically resilient communities we have ever seen. And they are, you know, they will work hard, they will strive, they will survive. But that doesn't mean that, you know, they're inherently vulnerable. They're not people that are so helpless. There's a lot of power within that community, but it's a systems issue that have made them vulnerable, and have put a lot of social determinants of health against, you know, against them in order to have that vision of that vulnerability. But it's not an inherent quality of those communities.
Thank you. Thank you. I'm going to go to you, Elena, and I'm going to each of you, I'm going to ask. And Dr. Ibrahim is breastfeeding her child right now. So go for it, Elena.
Oh, I was going to let Layla go. I saw her unmute first.
I'm sorry?
I was going to let Layla go first. I saw her unmute.
Sure. Go ahead, Layla.
Okay, thank you. This is something that I've been thinking about a lot, and like my immediate thought when you said this was, every single time I've turned on the news the last couple weeks, all I've heard is just that like Black and brown people are dying at higher rates. Black and brown people are being affected more. This is what's happening. This is what's happening. But there's not any like action behind that. There's not any points like Dr. Anisa was bringing up. Like there's no actual structural things that people are like saying, here's what we can do. And that's something that's been incredibly frustrating for me, just as a person having to sit back and witness this, having to hear every single day that like your community is dying, your community is dying, you're dying, you're dying, you're dying, is incredibly exhausting. And I think that a lot of the times, like the CDC and like the higher ups and like the people that are really in charge of these systems have come to feel like just acknowledgement is enough, and acknowledgement is not enough. It's not enough to tell me that I'm dying because I know that I'm dying. And it's frustrating because it's at the same time, truly like what needs to happen is like a complete and total upheaval, but that's not what's going to happen. And it's not possible. And so it's really difficult. I think something that I've been struggling a lot with is trying to find like a balance between, instead of just like feeding me this information that is painful to hear and that I already know, but the actual solution is also not possible, because that would mean like a complete and total destruction and restructuring of society. And that's not going to happen. I think something that I've been really wanting to see, and I don't know if it's going to happen, is just seeing, like, acknowledging like the holistic approach to health, acknowledging that, not just acknowledging, but actually moving towards and actioning that we need, we need a restructuring of our housing system, understanding who lives in public housing, what public housing looks like in this country, where it's placed, why a lot of our communities that are lower income are living in toxic neighborhoods, like places that are literally killing them because they're living near, they're living in food deserts, or they're living near like factories where the air is not as clean. And that's leading them to be more unhealthy. They're living in places where maybe it's not as safe to go outside and to get exercise, or maybe the people that are in those communities physically do not have the time to go out and dedicate to exercise, so their bodies are not as healthy. Understanding that, like understanding the implicit biases that a lot of our healthcare professionals have, and like the biases that are supported by the system, start at a very young age. Understanding that Black and brown children are more likely to get in trouble at preschool, are more likely to like be held back at preschool and in kindergarten at the very early stages, and seeing that discrimination at 3 years old, 4 years old, 5 years old stays with you, not only as a student, as a child of color, but also the white children who are hearing these negative stereotypes, hearing these awful racist things at home, and having them reinforced at school and continue to be reinforced for the rest of their lives. And knowing that those are the children, the people that are more likely to become our doctors, to become our politicians, to become our lawmakers and our policymakers, and to see that, to have, I'm sorry, my brain is like moving quicker than my mouth can. But understanding that it really starts from the root. It starts from the very beginning, and we have to have a complete and total interconnection of all different aspects of life, because all of that affects our health. Like again, Dr. Anisa, I can't, like, there's nothing I can say to like add on to what you said, because what you said was so perfect. But earlier when you mentioned that stress affects us on like a biological cellular level, like seeing that stress, where does that stress come from? It comes from all different aspects of our life, and it bleeds into our healthcare system. And it's killing us just as much of just as the virus is killing us. It's been killing us before the virus. It's going to continue to kill us after the virus. And how we can stop that as a society. And so just having those conversations and actioning that, as well as acknowledging the terrible facts.
Thank you, thank you, thank you. There's no need to be sorry, my dear. You said it right. You laid it out, and it's the truth, period. Elena, what would you like to add to what do you think, where do we need to go from here so that we don't continue to perpetrate a system of inequality and oppression and injustice that we've been subject to, that's killing our people and killing all of us with that toxic stress?
We do not go backwards. I feel like, yeah, we do not go backwards. We don't accept the status quo. And like turn to each other, and like I just, while Layla was talking, I was like, Layla's it, Rahwa's it. Like, why we and all the why we people and community watching, like we're it, like we're the answer. That's where we go from here. I know we need structural change, and like us as individuals, like we still have to survive and live our lives, and you know, we alone can't fix how broken everything is, and we've known it's been broken. And yeah, that's kind of my hope. Is I know like we can't have an upheaval, like looking at the realisticness of that, but I think it's us turning to each other, sitting in our wisdom, sitting in our truth, you know, not letting the systems tell us what the truth is. Like, we know what the truth is. We know what's not working. We hear each other, we see each other. And I think it's places like why we, like the things that are happening in why we, like hearing each other, seeing each other, like, you know, like our leadership, us, like it's I think like this is the answer. Like, this is how we get the system that we need. This is how we get the care that we need. Like, we are the answer. I don't know how else to say that, but yeah. And like, can we get capitalism out of healthcare, please? Like, like, yeah. And I feel like the virus in its own way is dismantling what's not working, like as painful and how much grief is going on. Like, it sucks. Like, it's a really painful way. And you know, like, I don't know, I was reading this book talking about like the life death cycle, right? Like, this is going to get kind of like abstract, but like, yeah, things, not just people, but things and parts of the system are dying because they don't work. So something's got to grow there, right? Like, so I just been thinking more on like our role, as scary as it is, like, how can it be us, like us sitting at the table, being the ones nerding out on the research, like us being the ones checking the system and creating what we need to create and looking to each other to do it when the system tells us that it's not an answer, right? Like, I don't know, that's not very specific, that's very big, but that's just how I see we should go forward.
Thank you, Elena. I love what you say there, because it cannot be specific, right? First of all, it needs all of us. Not one single person, not one single expert is going to have the answer to this. We really need to come together and be part of the community, comunidad, you know, we can share all of our perspective and then see what emerges, because definitely we're in that transitional liminal space where something is dying and something else is getting ready to be born. The question is, what is that going to be, in which direction it goes? And that's where I think, I love what you were saying, Layla, in terms of like, we need action. You know, we need action, not just acknowledgement and re-traumatizing, but we really need to have action. And I'm going to ask Rahwa if you want to say something before I start summarizing some of the ways that maybe we could take some action. You good?
Okay, yeah, I'm good.
Okay. So in terms of action, I was looking at how do we restructure society. How do we let's see, the collective has the solutions, but also just if for those people who might be watching us over YouTube that identified as white, I would say that you need to do the work. You need to do your work. I am grateful that you're watching this and that you're connecting to us, because you really need to seek out the voices and the relationship with communities of color, and not come into the communities of color as an expert, but as someone who is interested in being part of and learning, right? Because so that's important. Subscribe to this YouTube channel and subscribe to some of the other channels and information sources. That there's some amazing people of color out there, like really speaking truth and really visioning a new world. And so seek them out, you know, and be a good ally. Right now, this is a time for generosity. Generosity in all levels. There's a lot of people that are suffering, that are that might need food at the food banks, like Burbar Place and like El Centro and other places. You know, donate to the food banks, donate to communities. Dr. Ibrahim is part of the Somali Health Board. They're doing a whole bunch of work in the Somali community. Donate outside from your traditional sources, you know, big institutions, etc. Give at the grassroots level. And then also, you know, when you have opportunity, if you have influence to uplift the voices of people of color, do that. Put some of your own privileges at risk and support undocumented people. Um, the people who are in jail right now, that are incarcerated, that are getting ravaged by the virus in these systems, that are in there for very crimes that are not even legal anymore, like marijuana, like having marijuana in your possession in this country. I mean, at least in Washington State, you know, that's no longer a crime. So, you know, there's people still in jail for those kinds of things. Let's let people out of jail who don't need to be in jail. Any other solution, guys? Any other solution that you can think of? Let's see if anybody on our chat want to add anything around that.
The one thing that I would say is let's continue speaking for those who might not be privileged to speak up on their own.
Yes, 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 yes. Thank you, thank you. And then let's continue to make visible that which is not visible. Let's continue to make visible that which is not visible. Whenever you walk into a space and you're saying that someone is not there, ask. In the same way that we were asked and I was asked, I think that is a good precedent, and let's continue to do that. And if you're grounded in spirituality in any way, I say pray. Pray in whichever form works for you. There's been a lot of people who have transitioned on this planet right now, both in the United States and in other parts of the world. Let's pray for them. Let's light a candle if that feels called to you, or whatever your spiritual tradition is. I don't know how we're going to manage. This is definitely changing us at a very deep cellular level. And we need to be our brothers and sisters keepers. And so I think I see there's one more here, and then I will, let's see what if, oh, it's just saying that we're getting lots and lots of love. I want to take the next minute, and just each of you could just do a little closing, and then we're gonna say goodbye to our friends. Who would like to start? It's your closing goodbyes. Rahwa, go for it. I see. Were you getting inspired?
I was getting inspired, yes. A closing. I would like to thank everybody that took their Saturday, couple hours of your Saturday. You know, this means a lot. It means a lot to a lot of more people than you think. And don't be a bystander. Like, speak up. help like your neighbor, be there for each other is what I'm gonna say, and continue praying like Victoria said. So yeah, and thank you for being here.
Thank you, Rahwa. Thank you. Layla, why don't we go to you and then we just keep going?
Yeah, I think I'm just gonna say that it's so important right now, especially like as women of color, just to take care of ourselves, because like so often we're taking care of other people. So just it's okay to be a little bit selfish and to take care of yourselves, but also to check in on one another. Yeah, so I know Aisha's been checking in on me a lot, and I really appreciate that for her for that. So just take care of yourselves, check in on one another. Yeah, and we will get through this.
Thank you, Layla. Elena?
I guess I just want to close by thanking why we and just that everyone has been there for me to remember community, and I think community is really important. And I guess the only thing I else want to add is just trust yourself.
Thank you. Dr. Ibrahim?
Thank you. So in closing, I want to say don't despair and trust the inherent strength within our communities, trust our ability to heal within ourselves, but collectively heal within a community, and trust that, you know, we are in this together truly in every sense of the word, and we are these communities, our communities have been through so much, and we will not let this break us. And there are people in every sector of every profession who will continue to advocate for ourselves and each other. And I just want to conclude by saying, you know, look for the little bright spots in the day, whether it is you know, the smile of a baby or a butterfly, or being able to open your door and see greenery, whatever it is, or being, you know, or praying or hearing, you know, the call to prayer, as it is for, you know, many Muslims right now during Ramadan when we're not able to gather, whatever that is, just acknowledge those and really live in the beauty of those moments.
Mm-hmm. Thank you so much for those beautiful words from all of you. Why We continues to do programs online, like Rahwa was mentioning, with the alumni program, but there's also a lot of other programs for young people to tap into. So please visit our website and sign up for any of those activities. And also, we do have some mental health support. So if anyone needs to just check in, have like a one-on-one check-in or be part of a group, please connect with us on our website. And we're in the midst right now of trying to plan for summer, and who knows what's going to happen. So we're in the emergence, and our staff members are putting lots of energy behind trying to figure out what that might look like, whether we could do things in person or not. So just please stay connected to us. We're here for you. We want to thank all of our partners and sponsors and all the people that have just shower us with so much love. We're just eternally grateful. And I want to thank Emma and Aisha for helping us today and putting all this whole panel together. I am deeply, deeply grateful to all of you for saying yes, and to our wonderful organization that we get to co-create and build it with people like you. So thank you, everybody. Have a good rest of your day. I think the sun is peeking through.